What is an opioid crisis and why should you even care? You might think about this topic because you hear this a lot lately. Everyone talks about opioid crisis, but maybe you just brush it off because you're personally not affected by it. But think about this. We all function in society. We live in communities. Our religious organizations, our schools, our workplaces. There are people around you who you know pretty closely who are suffering silently. And how do I know this? As a physician, I have a pleasure and honor to be there when patients trust me with their innermost struggles. And they tell me things that they unfortunately don't feel safe telling people around them. And I've met so many people who you would never tell they're having a problem with opioid addiction, but unfortunately there is an issue there, and it's a pretty common one. Think about it. People who have ever been in a car accident or had an injury of some sort or been injured through sports, or they have been in the military before and they have injuries through that. Multiple other problems that are causing them chronic pain. Those people go and they seek out help from doctors. Like anybody, like anyone, like me or you, they're people just like us. They go and they seek out help, and medical professionals prescribed opioids for years without realizing how damaging it might be. People were not counseled about proper dangers of these medications and about the ways that unfortunately they will be addicting. And now that people are more aware, still it's very hard for them to remove themselves from this problem, to stop opioids, to decrease opioids because they're so addicting, because there's so many issues that come up when you stop taking this drug. It could be even life-threatening. People experience horrible side effects, nausea, flu-like symptoms, pain even worse all over their body, feeling like a zombie, they tell me, and just not being able to function as a human being. And most of these people are functioning like normal members of society. They have family members, they have children, they have work, they have bills to pay. They cannot afford to take a month off and just to take care of their addiction and put themselves in a rehab facility. It's pretty much impossible for most of them. So a lot of people suffer. And unfortunately, a lot of people became victims of this and died as a result of overdose, as a result of misuse of these medications. A lot of kids that are now in foster care because of, unfortunately, their parents over abuse and misuse of opioids. There's a lot of infants who are born with problems because of use of opioids during pregnancy, misuse of opioids during pregnancy. Why am I telling you this? Because somebody you know very closely could be suffering from this without you even realizing it. Just look around and think 2 or 3 out of 5 of your acquaintances in your community could be suffering from this problem. So what can you do to help? Number 1, we need to spread awareness. Education is number 1 tool to fix this problem. Number 2, we need to seek alternatives. And one of the alternative routes that I've used in my practice in the past 2 years has been medical marijuana. And a lot of people who hear this, all of a sudden right away, they feel, oh no, medical marijuana, no, that's bad. There's so much stigma attached to this, and so many myths and miseducation around this topic. I know because I personally have been one of those miseducated people. I was the one who was against this against people using this. I thought of marijuana as the worst drug than any other, as a gateway drug, as we've been taught. But now that I've used it in my medical practice for the past 2 years, I actually see it as a gateway out of the problem, out of the opioid addiction. Most of my patients were able to decrease the opioid use, if not eliminate it completely. I have patients who have been on opioids for years and years and have been suffering from the side effects and being unable to get rid of those prescriptions, who are now opioid free. So I've seen this absolutely as a miraculous solution for people. And marijuana is not lethal. It doesn't kill anybody. It doesn't cause any lifestyle problems for people who are using it as a replacement or in addition to their opioids. It reduces their pain. It reduces the side effects of the opioids and opioid withdrawal. So it helps them start living a better quality of life. Some of my patients tell me that their relationships have been saved. Their marriages have been saved. Their relationships with their children have been saved. Their jobs have been saved. They were on the verge of either being fired or having to quit because they couldn't function anymore. And now they're able to focus. They're in less pain. They're able to concentrate because they don't feel like zombies on those opioids anymore. And it's helping with their quality of life. So I invite you to come and participate and join in our important event that's coming up this coming Sunday in only a few days. If you haven't heard of it, International Jewish Cannabis Association is holding an event with other sponsors. We're gonna have a panel of physicians and other professionals who will talk about medical marijuana and holistic medicine as option to stop the opioid crisis, in order to decrease opioid use, in order to save lives. So please, don't brush this off as something that doesn't concern you. Share this video, share it on social media, share it in your email, because you don't know who it's gonna help. You don't know who's suffering. People holding it in because of the stigma, because they're afraid of what will others think of them when they find out they actually are addicted to opioids. So please share this. You don't know whose life you're gonna save. And we have to spread the awareness, and we have to spread the education. And even if you still feel a little wary of marijuana as a medicinal treatment, just come and listen and learn. Learn about scientific research. The United States, unfortunately, doesn't have enough scientific research because they're shooting themselves in the foot. There's still Schedule 1 medication federally. However, other countries like Israel, who has been using this treatment even in their hospital system for their hospital patients, has tremendous amounts of research. And we will be addressing it at this event. Just come and listen. Just keep an open mind and try to learn something new and spread the word and share your knowledge so we could save lives. I will see you on Sunday. Bye.